So this Insta lecture would be on chronic inflammation, and I would discuss about what causes chronic inflammation, what is chronic inflammation, what are the key manifestations of chronic inflammation, how is it different from granulomatous inflammation, and what are the common manifestations of chronic inflammation. These are the things I'm going to discuss. So first, to understand chronic inflammation, you need to know that what is inflammation. Inflammation is nothing but a response of our vascularized tissue to eliminate or to neutralize or to get rid of offending agents which are trying to cause some amount of cell injury or tissue injury. And why this is mediated by vascularized tissue, I already explained in my previous lecture on acute inflammation. Because through the vascularized tissue, through the blood vessels only, the body can send its machineries like inflammatory cells, immunoglobulin complement, those things to that site where the inflammation or the infection is going on. That's why the response is mediated by vascularized tissue. Suppose a war is going on at some country, at some place. Obviously, the country's administration would send his armies through some road or some helipad, some through this actually, and they need some infrastructure to send them there. That infrastructure in the body is the blood vessel. That's the idea. Now, what is chronic inflammation? There are two forms of inflammation already, acute and chronic. Acute is the instantaneous, immediate response of the body to neutralize those offending organism or offending agent which is causing cell injury. On the other side, chronic inflammation is a prolonged form of inflammation which has three key characteristics that you need to understand. Firstly, there would be a acute active inflammation that would be going on. Second thing, there would be a tissue injury, some amount of tissue injury would be there. And third thing is that there will be an attempt to repair that tissue injury. So if these three things, they are going together, that means an active inflammation, some amount of tissue injury, and the body's attempt to repair that tissue injury, these three things are going together in a form of prolonged inflammation. We call that inflammation chronic inflammation. And chronic inflammation basically occurs due to three reasons. If you are having some infection due to some offending organism or the organism, infectious organisms like Mycobacterium tuberculosis causing TB, Treponema pallidum causing syphilis, Mycobacterium leprae causing leprosy, Bartonella henselae causing cat scratch disease, this kind of organism, or could be due to histoplasma. This kind of organisms, when they are attacking our body cannot neutralize or eradicate them so easily. They are quite persistent in nature. In these cases, when we are infected by this kind of organism, our body responds by causing chronic inflammation. Second thing, the second thing which can typically cause chronic inflammation, if you have a prolonged exposure to some kind of toxic agents, typically described for silicosis. Suppose for a prolonged period you are getting exposed to the silica. So how your lungs should respond? Lungs should show huge amount of interstitial fibrosis. So this form of disease, which is silicosis, it's a form of chronic inflammation which is leading to that kind of fibrotic changes actually. Third thing which could lead to chronic inflammation is some form of abnormal immune response. It could be due to hypersensitivity reaction. It could be due to autoimmune disease. Autoimmune diseases like SLE, rheumatoid arthritis are often associated with chronic inflammation. So these three things are the key causes which leads to chronic inflammation. Some form of abnormal immune response, some prolonged exposure to some kind of toxic agents, and third thing is that if you are getting attacked by, or body is getting attacked by some kind of organism which are persistent in nature and difficult to be eradicated. Next thing that you need to know, that what are the key players in the chronic inflammation. The dominant player in the chronic inflammation is obviously the macrophages. And macrophages which are there are two kinds of macrophages, M1 and M2 macrophages. I've discussed them in a separate lecture or video, but the idea is that M1 macrophages basically they support the inflammation, and M2 macrophages they basically support the wound healing and the repair. That's the basic idea. The next thing that I would like to mention, that the other key players are lymphocyte, eosinophils. Eosinophils particularly play a key role in the chronic parasitic infection or allergic reactions. Mast cells could play a role in chronic inflammation. They can also play a role in acute inflammation and plasma cells. So the key players in the chronic inflammation, firstly there are the macrophages, then there are lymphocytes, then there are plasma cells, then there are eosinophils, and the fifth one I mentioned is mast cell. Now, what are the usual manifestation of chronic inflammation? Usual manifestation of inflammation that you can see areas of fibrosis, some form of new blood vessel formation, angiogenesis can be seen, and you'll be seeing typically lymphocytic aggregates in that lymphocytic infiltration in the organ. Now, another form of a specific form of chronic inflammation exists, which is known as granulomatous inflammation. And the key concept is this, that all granulomatous inflammation are chronic inflammation, but all chronic inflammation are not granulomatous inflammation. So basically, granulomatous inflammation is a distinctive subtype of chronic inflammation in which granuloma forms. What are granulomas? Granuloma are nothing but a microscopic structure which are made with aggregates of activated macrophages. And these activated macrophages, they take the form of epithelial cell. They look like epithelial cell, that's why they're called epithelioid cell. They are not truly epithelial cell actually. Basically, they are macrophages, activated macrophages. But they resemble, they look like, they smell like, they feel like epithelial cell. That's why we call them epithelioid cells. It's ending with YD. If anything ending with YD, as I mentioned earlier also, it means mimicking something like that, like metalloid. It's not truly metal, but looking like metal. Leukemoid reaction. It's not truly leukemia, but leukemia-like reaction. That's the basic idea. So, in the granuloma, basically we get a aggregation of activated macrophages, which usually take the shape of epithelial looking cell, epithelioid cells. There's a called epithelioid histiocytes or epithelioid macrophages. Other kind of cells we see in the granuloma are giant cells. Giant cells are basically those activated macrophages that can fuse together and form a multinucleated cell. This is called giant cell. Giant cells, we in the granuloma particularly see two kind of giant cell. One is Langhans giant cell, where the nucleus, they're arranged actually at the periphery in a horseshoe pattern. Another kind of giant cell we see foreign body, where there's a haploid arrangement. Other kind of giant cells are there, two kinds of giant cells, but these are the two key types of giant cells. I've discussed them in a separate video actually, the giant cells. So granuloma is basically, and the kind of chronic inflammation which is showing the granulomatous reaction, we call that granulomatous inflammation. So granulomatous inflammation is also a chronic inflammation, but it's a distinctive subtype of chronic inflammation, where there is a granuloma formation occurring, where there is a activated macrophages, they cluster together, and these activated macrophages are at the periphery, they are encircled by a rim of lymphocyte. And what is granuloma basically? Granuloma is body's attempt to get rid of some agent by forming a separate cell. I think you have seen the prisons, and what are the objective of the prisons? The objective of prison is to keep the criminals separately at a place where they cannot do any harm to the normal civilians. So obviously, when the body feel that they cannot get rid of an offending organism or some offending insulting agent, they put them in a prison, and that prison is basically, inside that prison the guards are these epithelioid macrophages, and outside of the prison we get a collar or rim of lymphocyte. They are the second layer of the security kind of thing. So basically, the body's attempt to contain an offending agent at one place by encircling that offending agent or that area by some activated macrophages, and at the periphery by a collar or rim of lymphocyte, that is granuloma. And if the granulomatous inflammation there are two morphological appearance of granulomatous inflammation we'll be seeing, the term called caseating granuloma and non-caseating granuloma. Caseating granuloma means that at the center of the granuloma there is some form of caseous necrosis is seen, like typically seen in tuberculosis or some fungal infection. Non-caseating granuloma means at the center of the granuloma there is no form no presence of caseous necrosis, because that is not the essential part, the caseous necrosis. The essential part of a granuloma is activated macrophages, which are called epithelioid macrophages, epithelioid histiocytes, and at the periphery there will be collar or lymphocytes, and you can see some giant cells there. So the central area of necrosis may be present, may be absent, may not be seen. If they are seen in that center part of the granuloma, we call it caseating granuloma. And many cases we don't see them, they're called non-caseating granuloma. Non-caseating granuloma, if you see in lungs, typically seen in sarcoidosis. If you see in the intestine, you can see in Crohn's disease. So this is the concept of the caseating granuloma and the non-caseating granuloma. So till now I told you that, in a summary, what I discussed actually, that chronic inflammation is a prolonged form of inflammation which shows three things going together. One is active inflammation, some form of tissue injury, and some form to attempt to repair the tissue injury. This is called chronic inflammation. It is actually a chronic prolonged form of inflammation. It basically occurs due to three reasons. If you are attacked by some kind of offending agent that is difficult to be eradicated, persistent in nature, it could lead to chronic inflammation. Secondly, if you have prolonged exposure to some form of toxic agents, actually it could lead to that chronic inflammation, or some kind of abnormal immune response like hypersensitivity reaction, autoimmune diseases could lead to some form of chronic inflammation. Then I told you the key players, 5 key players of the chronic inflammation. They are macrophages, lymphocytes, they are plasma cells, they are eosinophils in some occasions, and mast cells. Then I discussed about the morphologic features of the chronic inflammation. And then I talked about the granulomatous inflammation. And granulomatous inflammation, I told you, it's a distinctive subset of chronic inflammation where there is a microscopic structure, granuloma forms. And what is granuloma? Nothing but microscopic aggregate of activated macrophages, which take usually the shape of epithelioid cells, epithelial looking cells, but not really epithelial cells. And there could be some giant cells, and at the periphery there would be collar or rim of lymphocyte. And granuloma is nothing but the body's attempt to get rid of some, not get rid of, actually to contain them at a one place. It's like a prison or cell. When I think about granuloma, I think about a prison or cell. And the second significance of granuloma is that when you see a granuloma, my list of differential diagnosis is also narrowed, because there are only handful of conditions which causes granuloma, like tuberculosis, like syphilis, like cat scratch disease, like histoplasmosis, like Crohn's disease, like sarcoidosis. So there are only handful of conditions which are there which leads to the development of granuloma. So it narrows down your list, that list of differential diagnosis. That is the key significance of getting granuloma or finding granuloma in a tissue biopsy, that we have selective condition, but thousands of things can cause chronic inflammation, but only a selected few things can cause granulomatous inflammation. So granulomatous inflammation is a distinctive subtype of chronic inflammation which is characterized by the presence of granuloma formation in the biopsy. And this form of chronic inflammation where we see granuloma formation is called granulomatous inflammation. So these are the key things which we learned in this session in a nutshell. Thank you very much for joining in this session. I appreciate it.